it appears the health workers are beginning to get the attention of the federal government.
I think so as well. The federal government has pledged to settle outstanding 7 month salary arrears owed medical doctors and other healthcare professionals before the end of this month, August, in order to prevent a looming nationwide strike.
All right, so there you have it. I wouldn't blame the enemy president for welcoming what the minister said with cautious optimism.
In
And that,
parentheses.
exactly, because they say once beaten, twice
Exactly. They
shy.
don't promise and fail.
This wouldn't
Tire.
be the first time
Mm.
the government would come out and say, hey, we will do this, we will do that. But at the right time for them to start showing working, you find out that it will amount to one excuse after another. Why do we always allow things to get out of hands before we start addressing it? The health workers, they've been shouting, they've been screaming for as long as I can remember. The federal government came up with a new pay policy for the health workers, talking about the allowances and certain things. And the workers came out to say, no, federal government, this in 2025 will not work. Are we making progress or are we retrogressing? Compare what politicians earn, compare it with the allowances you're proposing to be paying us as health workers. They rejected it. Nurses and midwives rejected theirs. So it's been one complaint after another. And that leaves one wondering if consultations were not made before the federal government published the allowances and salary structure for the health workers. One would have expected a situation where the federal government would call on the health workers to say, okay, how many unions do we have in the health sector? Each union present your representative. This is what we are looking at. This is what we are proposing. What do you people have to say? If such consultations had taken place, I don't think things would have deteriorated to this level. But it appears we have a situation where the federal government feels whatever they come up with, they can push it down the throat of the health workers. But the health workers have made it clear, vehemently rejecting the proposals that the federal government has made. We can't rule out how important the health sector is in Nigeria. Yes, the politicians may not be patronizing the health sector, but majority of Nigerians, we do not have money to go to London or France for health care. So let's make the health care system in Nigeria work for the benefit of the majority who are not as fortunate as the few politicians who are the slightest headache will join their private jets and go see the best doctors in the best hospitals in the world. Our doctors are good enough. The reason why they are hot cake. Our nurses are good enough. Our midwives are good enough. Our healthcare workers. The reason why all over the world they are being shopped for. People are poaching them. So the question is, why is it that when it comes to Nigeria, these health workers are usually found wanting? Now, they are found wanting not because they don't know what they are doing, but the work environment, from the welfare to their security to the work environment, no tools to work with. So the federal government should do well to start addressing some of these things. If you know how much these politicians spend outside the shores of this country to take care of their health, that amount is enough to make a remarkable impact in the health sector in Nigeria. Let's make our health sector one of the best in the world. Once upon a time, the royal family in Saudi Arabia, they used to come here for their health checks. So what happened? Today, people go to Egypt, India, Turkey. It's quite a pity.
You asked what happened. Corruption happened.
It's quite unfortunate.
Lack of political will happened. Lack of a functioning system happened where people will steal money and get away with it. Here they will tell you $1.5 billion is missing, heads will not roll, no
Nothing.
name will be called. So the next person who comes on board will steal his own too. So it's a culture of impunity. That's what happened.